This video has been made for ACC graduates only. Taking this high-stake exam and using some clinical reasoning to kind of get through and figure out what the correct answer is. Today we're going to be walking through some processes for clinical reasoning to help when taking a high-stakes exam. The first suggestion is to really think logically and eliminate obviously wrong answers. Use that process of elimination to cross out those answers that you know for sure are not correct. Also use the dry erase board that's provided in the testing center to jot down notes. Now be careful that when you walk in, you don't use what is called brain dumping. And that is as soon as you sit down to write down whatever you're trying to remember. For example, like spinal cord injury levels. That's considered cheating, and so the testing center will actually consider that cheating, would ask you to leave. But you do use that dry erase board to take notes as you're going through to help you process the questions. Also, do not read into the question. For example, if you have a question that says you have an 80-year-old female, do not assume that 80-year-old female has any cognitive deficits if the question doesn't tell you that she has cognitive deficits. Also, don't assume that she has difficulty with ambulation just because she's 80. So don't read into the question. Only use the information that's provided to you in the question. So that being said, read the question very carefully. In this presentation, we're going to go through some sample questions with that. So the first one, the COTA reviews various functional activities that are being incorporated into her client's hand rehabilitation program. The COTA explains to the client that functional activities may include. So we're going to go through and use the process of elimination here. So the first option is active range of motion and self range of motion techniques. Well, we know that these are not functional activities, so we can eliminate that option. The next option is crafts, games, and self-care activities or self-care tasks. So we're going to go back and look at the question. So we know that we need something that's going to work on hand function, right? And we want functional activities. Okay, so B does have crafts, games, and self-care tasks. So possibly, right? So let's think about maybe using this one as an option. Okay, so the next option is cone stacking pegs and pulleys. That is definitely not functional, so we'll cross that out. The next option is mild, moderate, and resistive TheraBand activities. Again, TheraBand, definitely not functional. So if you go back, this question was asking for functional activities, thus B is the answer because that's the only one that's functional. Another strategy is to really go through and define the terminology given to you in the question and in the answer options to really make sense of the question. So let's take a look at an example. An individual complains of perspiration, which is causing his resting hand splint to be uncomfortable. The best action for the COTA to take is A, recommend putting talcum powder in the splint. B, line the splint with moleskin. C, fabricate a new resting hand splint with perforated material. Or D, provide a stockinette sleeve for the individual to wear inside the splint. So the first strategy is let's go through and define some of the terms. Perspiration is the first one. So we know that perspiration is sweating, right? Okay. Then let's take a look at our options for answers. The next term to define is talcum powder. So we kind of know what we're talking about here. Talcum powder is like baby powder, right? So it makes things nice and smooth, but not necessarily, we don't know if that's necessarily going to get rid of the sweating. The next term is moleskin, right? And if you remember from your book and in your lectures, moleskin is that kind of protective padding that you might add to a splint, and that's exactly what it does, is it provides padding. Okay. The next term is perforated material. Okay. So the perforated material does allow for extra air into the splint, right? So it's going to be the material, draw a picture down here. If you have a big piece of splinting material, it's going to have a whole bunch of little holes in it. Okay, so that's what perforated material looks like. Okay, the next term is stockinette sleeve. Okay, stockinette sleeve is that material that, if you remember, it is kind of like putting a sock onto the arm and the hand. And this is often you'll put this stockinette on as you're even creating the splint to protect from heat. But if you think about when you put a sock on your foot, right? And why do we wear socks? It's to absorb sweat and kind of protect our skin, right? So let's look at this a little bit, from the perspective of what is going to really help. What are we looking at here? The individual complains of perspiration, sweat. Okay. Well, we know that the talcum powder, that's not really going to get rid of the perspiration or keep the perspiration away from the skin. So let's eliminate number A, sorry. The next one is moleskin. Moleskin doesn't address perspiration, it provides padding. So let's get rid of B. Okay. So now, true to NBCOT exam style, we have two that sound like they could possibly be answers. Let's look at what would be the most cost efficient, right? And what would be the most efficient. So a stockinette sleeve, number one, that's very cost efficient, but it's also something that would be more efficient in absorbing perspiration. The perforated material, that helps, but it doesn't necessarily get rid of the perspiration. So between these two, D is actually the best answer. So we're going to choose D. All right. So another strategy is to eliminate answers which do not reflect the profession or the scope of OT. So maybe you have an answer that sounds more like PT or sounds more like nursing. You could eliminate those. Also, you can also eliminate answers which do not match the theory that's perhaps identified in the question. So if you see that there's a question that specifies the theory that's to be used, like sensory integration, then you know you're looking for in your answers a sensory integration related answer. You can automatically cross off those answers which do not match that theory. You can also cross off any options that might be unsafe for the client. For example, if your client has just had a hip replacement surgery and one of the options is, say, gardening, well, that wouldn't be safe because it's reaching down and they'd be breaking their hip precautions. Also, be very wary of options that say always, never, or all in the answer. Those usually are not going to be correct. Also, look at what setting is identified in the question. Is it, a hospital? Is it home? Is it a school? Look at the setting, and that should help you eliminate some of the potential answers and automatically say, nope, those don't match the setting. So let's look at an example. A long-term goal for a client following a hip arthroplasty is independence and lower extremity dressing. The most relevant short-term goal for the COTA to work on would be that the A, client will increase standing tolerance to 10 minutes. B, client will increase hip flexion to 90 degrees. C, client will demonstrate appropriate hip precautions. Or D, client will apply energy conservation techniques during dressing activities. So let's analyze this question. So we know that the client has had hip arthroplasty. So we know that they're going to have total hip precautions. So we're going to be looking for anything that might be unsafe for the client based on these precautions. Let's look at the next part of the question. So the goal is independence in lower extremity dressing. They're not telling us that for nothing. We need to be focusing on that. So now we're going to look at what are they asking us? The most relevant short-term goal, and we know that the short-term goal has to be related to this long-term goal. Okay, so let's look at our options. The client will increase standing tolerance to 10 minutes. This is definitely not an OT goal. This is a great goal for PT, right? We would never work on just increasing standing tolerance. Also, too, we don't need standing tolerance to do lower body dressing, so we're going to eliminate A. The next one, client will increase hip flexion to 90 degrees. Well, if we know, right, we know our patient has total hip precautions, right? We don't want to increase hip flexion, right? So we're going to eliminate that one. Definitely wouldn't be, this is also another PT goal anyway, right? We would never be working on increasing hip flexion. So let's look at the next one. Client will demonstrate appropriate hip precautions. Okay, well, that might work. Let's look at the next one. Client will apply energy conservation techniques during dressing activities. This is another case of don't read into the question. Why would the client need to do energy conservation techniques with a total hip replacement? That doesn't make any sense. Energy conservation techniques it does not match the client's needs. So we're going to eliminate that. So the most appropriate answer is C. Okay. So how do we choose between two good answers? Because this is typical of NBCOT, is that they will give us two options which sound really good. All right, so how do you decide between those two? Well, number one, choose which answer is more client-centered. For example, use the information that's given to you in the actual question. Like I gave the example earlier, if you have an 80-year-old client that has a dog, there's a reason why they told you she has a dog. So choose an answer that's related to her having the dog. Think about two, which is more developmentally appropriate. So if they give you the age of the client, choose something that's going to be appropriate for that age range. Also, again, remember, look at the theoretical framework of the question. Do they give some theoretical framework in there? They're not going to tell you that for no reason. Choose an answer that best matches that theoretical framework. And also think about what's the best fit for the phase of treatment. Is it in the acute phase? Are they ready for discharge? So think about what phase are they in? Did they tell you the phase? And if they did, they probably told you that for a reason. So let's take a look at an example. When treating individuals in the acute phase of cardiac rehabilitation, it is important for the COTA to first select activities that, so we know acute phase, we know cardiac, okay, and we see first. All right, A, can be accomplished without causing fatigue. B, decrease the effects of prolonged inactivity. C, promote strength, range of motion, and endurance. Or D, can be carried out independently after discharge. Okay, so we know acute phase, very beginning of cardiac rehabilitation. Okay, and we need to think about too that they told us first. All right, so we want to think about what can we automatically eliminate. I'm going to start at the bottom. So let's look at D. D, can be carried out independently after discharge. This would be a good answer if the the question asked for what would you recommend as the client's being discharged. So this has to do with phase of treatment. Okay, this whole question kind of has to do with phase of treatment. We're talking about first choices, and we're talking about acute phase. So we're going to eliminate D. C, promote strength, range of motion, and endurance. Well, we can take a look at this and we could say, well, this has to do with cardiac rehabilitation. In cardiac rehabilitation, we're definitely not really focused on range of motion. That already tells me that this option is incorrect. We might be wanting to promote strength and endurance, but definitely not range of motion. So we're going to eliminate C. Let's take a look at B. Decrease the effects of prolonged inactivity. We don't know that this person had prolonged inactivity, but we might be addressing it. So let's leave that for now. A, can be accomplished without causing fatigue. Okay, so we know they're in the acute phase, right? So that means they may have just had maybe a heart attack, right? A myocardial infarction. Or maybe even they just had a recent CBG surgery. I would think they'd probably tell us of that. But this is somebody who's in the acute phase, meaning still a little medically fragile, okay? So with B, it's assuming something that was not provided for us, this prolonged inactivity, okay? We don't know that this person had prolonged inactivity, so let's eliminate this option, okay? So the most logical answer is going to be A, can be accomplished without causing fatigue, because we're looking at it's acute and first. Okay, some other good suggestions for eliminating between two good answers. Use the process of elimination to determine which are not correct, which is kind of what I've been showing you here. You have to really think about what is the best option. And I know that's really hard when you haven't been out there in practice, but you kind of have to think about, okay, if I was the patient, what would be the best option? Also think about what uses the client's strengths. So think about what can they do and which of those options uses what they can do. And then which is the least restrictive or most cost-effective answer? Which doesn't require purchasing a whole lot of things? What is something that can be utilized right away, which would allow the client to be most independent now? And also too, again, going back to this last example that I just gave you, which option is not assuming anything and is not giving the client some additional impairments that were never told to you in the question. So let's take a look at an example. An individual's joint changes that limit finger flexion would be most comfortable using utensils with. Now, we have some things to look at. We have joint changes that limit finger flexion. Limit. Would be most comfortable using utensils. So we're looking for some type of utensils with. So we're looking at what's going to allow this client to use utensils, it's comfortable, and address limited finger flexion. So what I would suggest is take a look, and I'm going to, let's see, I would take your hand out and actually take a look at what does limited finger flexion look like, right? So limited finger flexion means you can still move your hand, but you have very limited finger flexion. Do this during exam if you need to, so you could kind of see. Okay, so we see here that your hand is, you're able to kind of pull into a little bit of a finger flexion. So that means that the best option is going to be a built-up handle. Okay. The other options were, using a regular utensil. Well, obviously, as you can see, If you have a regular utensil, and this is as you have limited finger flexion, you're not going to be able to hold on to a regular handle. Built up a weighted utensil, that's just going to be heavier. That's not going to help. Now, a universal cuff or U-cuff, that's not utilizing the amount of finger flexion that the patient does have. Okay, so a built-up handle would be perfect for the situation where the person has limited finger flexion. So in the end, you really need to look at what is the question really asking you. So let's take a look at this one. A COTA is treating a child with an above elbow amputation who's experiencing hypersensitivity of the residual limb. The COTA would most likely perform which of the following interventions in the pre-prosthetic phase of treatment? So what we're looking at is we have an above elbow amputation who has hypersensitivity. The COTA would most likely perform which of the following interventions in the pre-prosthetic phase of treatment? Again, this is telling us the phase of treatment, and there's no prosthetic. Okay, so let's take a look at, so we're looking for, again, let's look at what is the question asking us. The question is asking us for what would be an intervention to provide with this child who has hypersensitivity of the residual limb. Okay, so first option, A, play activities to strengthen the residual limb. The question never said there were any issues with strength, so we can eliminate that. Next one, activities to increase the range of motion of the residual limb. The question never said anything about issues with range of motion. C, play activities that incorporate tapping, application of textures, and weight bearing to the residual limb. Now, if we think about this, tapping, application of textures, and weight bearing to the residual limb, this all provides sensory input. These are good strategies for hypersensitivity, right? So this could possibly be an answer. D, dressing activities for practicing putting on and taking off the upper extremity prosthesis. Well, we saw right here, person doesn't have a prosthetic because we're talking about pre-prosthetic phase. So there is no prosthesis. So just by process of elimination, we know that C is the only answer that could be right. So I would suggest going through every single option. Read all the way through D. Cross off the ones you know are not right. That will help you decide. Even if you weren't 100% on C, by process of elimination, we figured out that C was correct. Anyway, I hope this was helpful.